I'm Irene Diamond, and I am the creator and founder of Active Myofascial Therapy, the Diamond Method. So I'm here today at the Oakworks studio, and I've got my model Mark, and I'm going to be demonstrating some active myofascial therapy techniques for the cervical spine, for the neck, because of course, as you know, most people come in with neck problems. And so this is just going to give you a little sneak peek, a little taste of what active myofascial therapy is. Now, with traditional massage, your client, your patient is passive, either in the chair or on the table while you're applying your methods and modalities to your client. The difference with active myofascial therapy and active muscle massage is that the client is doing half of the work, so it makes your job so much easier. So I'm going to show you a little bit of techniques for his neck, and then what I want to just emphasize is with active myofascial therapy, like other modalities that are more corrective based rather than relaxation based, I really emphasize the fact that you want to first do a quick assessment. So obviously if he came in with a whole bunch of things presenting with a lot of complications or dysfunctions, then you're going to want to do a full assessment, but for the video's sake right now, we're going to do just a quick assessment of his cervical spine and his neck and shoulders. So Mark, do me a favor and just face the camera and sit up tall for me. First thing you always want to have your clients do is sit up straight, because as you know, most people don't. Pointing him out right here on the camera. So I use a stool for this because this way we are on the premium swivel stool, and this allows him to allows you to accommodate his height, and by dropping the height of the stool or raising it if you have a shorter person. So you have better body mechanics, because that's key. So you want to use a stool when they're sitting rather than a stationary chair if you can. And so Mark's sitting up tall. So what I want you to do, Mark, I'm going to put my hands right on your shoulders. Would you just look over your right shoulder towards my finger as far as you can go, and let me know if you feel any pull or pain or pinch. So we always ask that. Do you feel any pull or pain or pinch?
Yes, I do.
Okay, and where do you feel that?
In the back of the neck on the right side.
Okay, so he mentioned in the back of the neck on the right side. Now I'm also looking to see how far he can turn. 85 degrees from 0 to 90. 85 is about where we want to go. So he's at he's probably at about 60 degrees. Then I'm just eyeballing this. Okay, and then let's have you turn to the left side. And you can tell he has much greater range of motion going towards the left. And do you feel any pull or pain or pinch?
It's still pull and pain in the right side.
On the right side. Okay, that's perfect, because I was going to be doing the right side. So it worked out nicely. Thank you. Okay, so turn your body that way just a little bit. And again, it's really common that the person will start to slouch down again. You can have them slouch while you're working, or you can remind them to sit up straight, because posture is so key in any resolution when you're working on cervical spine and pain and dysfunction. So you want to get in here, his head is straight, and you want to just feel around a little bit. Obviously, I'm going to just shorten the therapy that we're going to do, but I'm going to feel and ask him to let me know if I'm hitting any hot spots. In AMT, we refer to them as hot spots. Most of the time, they're trigger points or adhesions, not always. So sometimes you can use 2 fingers, or you can get in here and use your thumb. So Mark, as I'm going, you can use your other hand to stabilize. As I'm going along, let me know if I'm hitting any hot spots. I'm going to guess there's one right about there.
Yes.
Okay.
On your thumb.
Okay, yep, under my thumb. So we use a 0 to 10 scale of comfort, rate of perceived comfort, not pain. So what number on a 0 to 10 scale, with 9 or 10 being ow, too much, what number would you give this right here?
A 5 or 6.
Okay, perfect, 5 or 6. So 7 or 8 is the depth that we want to go. So I'm right at about a 5 or 6. What I'm going to do is now, here's the active part. Mark, gently drop your chin down. And that will increase his sensation, am I right?
Yeah.
Okay, and it went up to like about a 7 or so?
That would be right.
See? Darn, I'm good. And so what we do is I hold this. I can readjust a little bit if I need to. I want to get right directly. Usually it's on the TP, the transverse process. I'm just pressing directly in. Now this is a little controversial because some people tell you not to do this. I'm going to stabilize right here. I'm going to just apply a little bit of pressure. And now, Mark, what I'd like you to do is gently nod your head. Yes. Small movement, and slow it down just a touch. So you see the difference here. This is not him being passive. This is him being active. He's dropping his chin and he's elevating it. And as he does that, we're providing a cross fiber and a longitudinal eccentric concentric contraction of the muscles underneath my thumb. Now, obviously, there's a lot of what's the word I'm going for? A lot of different angles that the fibers are attached right there. So as he's moving his head up and down, we're creating a different degrees of pull on those muscles and on the fascia. Now, Mark, as you drop your chin, hold it there. And now, slow motion, I want you to just shake your head no. Small movement. So again, I'm just holding this constant. I haven't even moved my thumb. And he's creating the movement underneath my thumb. I'm holding it stationary. So it's a little bit of pin and stretch as well. Good. And slowly release. And sit up tall and let me know how'd that feel for you.
Actually felt good. If I was looking for some relief, it provided it.
Good. So after you've done what we call a simple hold, which is what I started with, I just simply went in and held the spot. He did nodding and shaking, which we call longitudinal, eccentric, concentric, and then cross fiber. So I held the spot, but he did all that. And then we do what we call pull the taffy, which is basically just taking the fascia and the muscles and just stretching it. And again, notice I'm not sliding over the skin. I'm just pulling it all the way in different directions, just, literally pulling the taffy and stretching the fibers. Now, as you probably know, or as you should know, the key for rehabbing any dysfunction, any scar tissue, any adhesions, after you've loosened everything up, which is what we just did, he needs to take the muscles through its new length. So I'm going to just stretch him a little bit in a lateral side flexion here. Obviously, you let me know if there's any pain or discomfort. Good. And now come on up and turn to the right again. Look with just your head, go to the right. Now notice he wants to extend his neck a little bit, so I'm going to just straighten him out. Turn as far as you can to the right. There you go. Perfect. And then go back to the middle. And how did that feel? And there any pull or pain or pinch? Any change? You can be honest.
Still a little bit of pain, but it was looser, and it felt better to do it.
There you go. So that was, a minute or so, right in one spot, and that was at about C2, second cervical vertebra. And so what happens with active myofascial therapy is you'll notice it's really fast. It is super fast work. The client likes it because they get the results that are so quick. The therapist likes it because it's easy. As long as you know where to go and how to assess, you hold the spots, they do all the work. It's super cool. Okay, sit up tall for me again. I'm just going to demonstrate a little bit more where you take it side lying or side flexion, and you can do the same all along the occipital ridge. Anywhere they feel hot spots, you can use these same techniques. All right, thank you, Mark. Okay, so this is active myofascial therapy. I'm Irene Diamond. If you like this, you can go to thediamondmethod.com, thediamondmethod.com, and you can sign up to get notifications of our upcoming seminars, and I'd love to see you there. Thanks so much. If you like this, give it a thumbs up on YouTube. Thank you.